Does it generally take slightly longer for a cream to work than a tablet or an injection?
Not necessarily. Methotrexate takes 3 months to start working. Some of the biological treatments are quite quick to start working, but they may not work in some people, and then they can work and then they can stop working. So it's not always, and then when you stop these drugs, they're not cures, so the psoriasis can come back.
How much light therapy would you need to get rid of moderate psoriasis? And also, are the home red light?
Oh no, those are terrible. No, I don't think that they're safe. That's the problem. The sun can help psoriasis, so that's why we give UV light therapy to help with psoriasis. But it's not good to use sunbeds because that's not, it's unregulated light can cause skin cancers and things. So it has to be specific doses of UV radiation can help with psoriasis as well. Now, what I tell my patients is during the summertime, it's not a bad thing to get a natural amount of sunlight. However, we don't want to increase people's cancer risk. So there is a balance. So what we do when we use UV light to treat patients' psoriasis is we give controlled doses, normally 2 or 3 times a week for a period of maybe 2 or 3 months. So they might have 30 sessions or 40 sessions, and it's given in a very controlled manner. And if somebody has a personal or a family history of melanoma, then we won't give them light therapy.
So once you get to the point that you've had multiple sessions of light therapy, whether you're using creams, and you're at the point where you've got rejuvenated skin, what's a good way to keep the skin in a place that it's not, the psoriasis isn't going to come back? Do you have to keep using treatment, or you can just go back to regular life?
Yeah. With most people, it's about controlling lifestyle factors. So to reduce the risk of getting those flares, it comes back to, again, weight, not smoking, healthy diet, not drinking alcohol, and then if and when the flares of psoriasis do come back, to get early treatment. So light therapy for you would be inconvenient because of your travel, but we might consider putting you on a tablet treatment, a tablet immunosuppressant, so something like methotrexate or azathioprine, but they've got their own risks and side effects.
So what sort of risks and side effects would come with those two, for example?
They're both kind of blanket immunosuppressants, so they will suppress your bone marrow, so they'll make you more prone to getting infections, and methotrexate is my favourite immunosuppressant, but it can affect your liver, so that may be a problem with you. And you can't get pregnant when you're on it, which is important in women of childbearing age.
Yes.
So that's why people don't like using creams to treat their skin conditions, but if you line up the topical treatments with the immunosuppressant and biological treatments, and you look at all their risks and side effects, actually using the creams that were given in the first place are actually the safest way to treat this condition.
And then what's the likelihood of psoriasis going away on its own if you didn't have any treatment?
It comes and goes, so it is perfectly possible for it to. But once if it's severe and you don't treat it, it's less likely to just completely go away.
Start spreading, especially if you're stressed.
Yeah, exactly.
Okay.